Hello to all. So welcome back to YouTube channel MEDICO'Z Factory. So today we are going to start the new subject gynecology with a continuation of series, because the anatomy of the external pelvic organs is already uploaded by Dr. Shiraj in the part 1. Now we are going to study is part 2. So today we are going to discuss is the anatomy of internal genital organs of the female reproductive system. So in case of doubt, please use the comment section, and whatever the content provided here is verified by the top first faculty, so you can use the content for your exams as well, and the theory portion which is provided here you can use for your MCQs purposes and all. Clear? So let's begin. So internal genital organs. The internal genital organs in females include vagina, uterus, fallopian tubes and ovaries. These organs are placed internally and require special instruments for the inspection. So there are the 4 internal organs: vagina, uterus, fallopian tubes and ovaries. Same like the external organs like mons pubis, labia minora, labia majora, vestibule. Clear? Now vagina. Now we will learn each organ in a detailed manner in the different sections. So in today's section we are going to learn is vagina. So the vagina is a fibromuscular membranous sheath, because it contains both fiber and muscular membranous sheath, communicating the uterine cavity with the exterior at the vulva. So in the vulva, mons pubis, labia minora, labia majora, vestibule, with all these organs it connects exteriorly with the vulva. It constitutes the excretory channel for the uterine secretion and menstrual blood. So in the both urine and the menses, both are secreted as a waste product through vagina. It is the organ for copulation and birth canal for the parturition. So the birth is through vagina, and the canal is directed upward and backward in the both the way, forming an angle of 45 degree with the horizontal in the erect posture in this way. Clear? The diameter of the birth canal is about 2.5 cm, being the widest in the upper part and narrow at its introitus. So when the birth canal starts, it is like this. Here it will be bigger, and as you go down it will be narrower. On the upper portion it will be wider. Now if we talk about the walls of the vagina, it has got anterior, posterior and 2 lateral walls. So you can see in the figure, this is anterior wall, this is posterior wall. The anterior and posterior wall are opposed together. See, you can see this is anterior wall, this is posterior wall, and comparatively stiffer, especially at the middle, and as it looks H-shaped on the transverse section. So when you cut transverse, it looks like this, H shaped. The length of the anterior wall is about 7 cm and the posterior wall is about 9 cm. So posterior wall is more bigger. Clear? And there is an anterior wall. The upper end of vagina is about the pelvic floor. Now if we talk about fornices, the fornices are the clefts formed at the top of vagina due to the projection of the uterine cervix. So due to cervix, the clefts are formed on the anterior vagina wall, which is inseparable wall. There are 4 fornices, 1 anterior, 1 posterior and 2 lateral. The posterior one is deeper and anterior one is shallow. Clear? Now if we talk about the relations of the vagina, anteriorly upper 1/3 is with the bladder, lower 1/3 is with the urethra, and the lower half which is embedded to its wall. So you can see again in the figure, same. Clear? So the lower 2/3 is with the urethra and upper 1/3 is with the bladder and firmly with the walls. If we talk about the posterior relation, the upper 1/3 of the posterior relation is with the pouch of Douglas. Middle 1/3 is with the anterior rectal wall, which is separated by rectovaginal septum, and the lower 1/3 is separated by the anal canal through the perineal body. So you can see in the figure, The upper one third is at here, that is the pouch of Douglas. The middle one third is separated by the rectal wall on the rectum, and the last anal canal by the perineal body through the anal canals. Clear? So these are the posterior relations. Now we will see the lateral walls relations. There are two. The upper one third is related with the pelvic cellular tissue. So it is of the cellular tissue in the base of the broad ligament in which the ureter and the uterine artery lie approximately 2 cm from the lateral fornices. So the upper one third lies in the pelvic cellular tissue in which two content are there, ureter and uterine artery, which is 2 cm from the lateral fornices. Clear? Now if you see the relation, the middle third is blended with the levator any. So you can see this one, middle one third by this levator any, and the lower one third by bulbocavernosus muscle, vestibular bulbs and Bartholin's gland. So these three content are lower one third, and the middle one third is levator any. Bulbocavernosus muscle. Remember well. Now if we talk about the structure of vagina, this is a histological. Now layers from the outward we will see. So the mucous coat, which is lined by the striated squamous epithelium without any secretion gland. So this is the mucous layer, which has no secreting gland, and this is formed by striated squamous epithelium. And then submucosal layer of the loose adioval vascular tissues. So there is a submucosal layer of the vascular tissues. So vessels will be there. Then the muscular layer consisting of the indistinct inner circular and outer longitudinal end. These all are the blood vessels, because vascular and smooth muscle with the inner circular and outer longitudinal. So you can see this is the layer, inner circular, outer longitudinal, this way. And last is the fibrous layer, which is derived from the endopelvic fascia, which is tough and highly vascular. So this is formed of endopelvic fascia, which is external fibrous layer. So mucosal, submucosal, muscularis and fibrous, 4 layers are there from inner to outer. Inner to outer. This is a histological structure. Now if we talk about the epithelium of the vaginal epithelium is under the actions of sex hormones. At birth, up to 10 to 14 days when the childbirth is there, the epithelium is striated squamous under the influence of maternal estrogen circulating in the newborn. Due to the maternal estrogen on the hormonic level, because it is based on the sex hormones, so during birth and up to the 10 to 14 days it is of striated squamous. But thereafter, up to the pre-puberty, that is up to the below the 14 years, and post-menopause after the 45, the epithelium becomes thin, consisting of a few layers only. So there will be the distinct changes in the layer. Clear? Now if we see the chart, during the birth to 2 weeks, there will be the presence of the estrogen. The epithelium will be like this. Glycogen will be present. The acidic pH will be found, 4 to 5. At that time the flora will be sterile, which will be of the Doderlenis bacilli. Secretion will be abundant. Doderlenis bacilli. Then 2 weeks to puberty, estrogen will be not present. The layer will be of the epithelium will be like this. There will be no glycogen. The pH will be slight alkaline, and the Doderlenis bacilli will be absent, and the secretion will be also scanty. During the pre-puberty, estrogen will be present. Glycogen will be present. The pH will move from alkaline to the acidic, and the cocal bacilli will be found, and it will reach bacillary. During the reproductive phase, the highest level of the estrogen will be found, and the glycogen will be present with the structural changes in the epithelium. The pH will be acidic. Again the Doderlenis bacilli will be present, and the secretion will be the abundant. So remember the reproductive phase, where you will find everything to be the maximal. And during the post-menopause, the estrogen will disappear again. There will be the no glycogen. The layer of the epithelium will be more thin. The layers will decrease. The pH will be either basic or the neutral. Again, the Dodder-Lens bacilli will be absent and the secretion will be scant. So the changes happen from the 2-week to puberty to the post-menopause. The changes will be almost similar. And the reproductive phase, there will be the maximal, and during the pre-puberty and the birth up to 2 weeks, you will find almost similar. So this chart is IMP for both theory and MCQ purpose. Okay. Now if we talk about the secretions, the vaginal secretion is very small in amount and sufficient to make the surface moist. Normally, it may be little excess with the mid-menstrual or just prior to menstruation, we have seen, and during the sexual excitement and pregnancy. The vaginal secretion consists of tissue fluid, epithelial debris, some of the leukocytes, which will be the pus cells, occasional pus cells, electrolytes, proteins, and the lactic acid. The secretion is mainly derived from the glands of the cervix, uterus, transduction of the vaginal epithelium, and Bartholin's gland. These four structures are responsible for the secretion and during the sexual excitement during the Bartholin's gland. The pH is acidic and varies during different phases. We have seen somewhere it is basic during the pre-puberty and the menopause phase. During the reproductive phase it is acidic. During the birth up to 2 weeks it is acidic. During the menstrual cycle it is acidic. So that way the pH of the vagina will vary. And the conversion of glycogen in the exfoliated squamous epithelium to lactic acid by the Dodder-Lens bacilli is dependent on estrogen. So it is based on the hormonal, because we have seen that at somewhere the Dodder-Lens bacilli was present and somewhere it was absent. More in the presence is dependent on the estrogen, and its function is to convert the glycogen present in the vaginal mucosa into the lactic acid. So the vaginal pH is maintained towards the more acidic side. Clear? And at such pH is more towards acidic during mid-bearing period, childbearing period, and ranges between 4 to 4.5 with average to 4.5. So 4 to 5.5 there on an average of 4.5. More acidic pH is maintained. And the pH is highest in the upper vagina because of the contaminated cervical secretion. Clear? But it will be more towards the basic pH. The glycogen content is highest in the vaginal fornix to the extent of 2.5 to 3 mg and is lowest in the lower third being 0.9 to 0.6 to 0.9 mg. Dodder-Lens bacillus is a rod-shaped gram-positive bacilli which grows anaerobically on the acid media. It appears in the vagina 3-4 days after the birth and disappears at the 10 to 14 days. Clear? So Dodder-Lens bacilli appears on the birth and disappears on the 14th day. It again appears at puberty, disappears after menopause. We have seen already in the chart. It probably comes from the intestine. Now if we talk about the blood supply of vagina, it is supplied by cervico-vaginal branch of uterine artery, vaginal branch, mid-rectal branch, internal pudendal. And if we talk about the nerve supply, it is by the sympathetic and parasympathetic nerves from the pelvis plexus and pudendal nerve. So this was all about the today's section. So in case of doubt, please use the comment section, and the various organs of the internal will be discussed further. So I hope this session will be proven helpful to you. Thank you. Have a nice day.